everybody. I think we're going to go ahead and get started. Councilwoman Walton Gray is a little bit behind, so she's going to join us when she can. But Jen, is that okay? I believe we have a quorum with Councilwoman Days and I.
You do. You're a 3-person committee, so you have a quorum with 2 people.
All right, great. Then we will get started. One second here. I have all these computers everywhere. All right. The purpose of this meeting is to share information about encumbrances and expenditures, contracts that have been awarded, changing needs in the community, and projections of future need, and to engage the public in a debate about how future coronavirus aid, relief, and economic security CARES Act grant money is spent. Will you please take the roll?
Yes, Madam Chair. Councilmember Dunaway.
Present.
Councilmember here. Councilmember Gray. Madam Chair, you have a quorum.
Thank you so much. The committee takes official notice of and admits into evidence all St. Louis County ordinances and resolutions. Good morning, everyone. Thank you so much for being here today. We are several weeks into the pandemic, and our response, in addition to everything that's going on with the pandemic response, we also have a global issue with police brutality and people asking for demanding change. I believe that those demands are also part of our responsibility in this oversight committee and things that we need to take into account as we move forward, as we spend the rest of this money, ensure that it gets where it needs to go, and making sure that we are holding our police, St. Louis County Police Department, accountable for its portion of the spending, which we will talk more about later today. Again, thanks so much for being here. And Cindy, I am going to hand it over to you for your presentation.
Good morning, everybody. Happy Tuesday here. What I'd like to do is, I hope everybody has a copy of the deck. Chris, I know you're going to bring it up here momentarily and really kind of give you all an update around the humanitarian grants, where we are, and go into a little bit of detail around housing, and also talk about the small business relief grants and where we are, and then respond to the question or show you the visual around the police question. So on the humanitarian grants, we issued that. Chris, if you want to advance the slide, please. So we issued the humanitarian grants on June the 3rd, and they were really bifurcated into 2 areas. And this was around childcare as well as housing. We're going to talk a little bit about more about housing, but Chris, if you'll advance the slide, please. So the child care provider RFP, this is really an entitlement program for those child care providers that are over 400 in the county, using the formula that you can see here on the screen. We have been in the process of instructing the providers in terms of what the grant is all about, how they need to apply. We had the webinar actually held yesterday to talk through all of this. We're also looking at actually having technical assistance provided through Child Care Aware and United for Children. And this is really for those child care providers that have 10 or fewer clients or capacity, because a lot of them are not as sophisticated as others and maybe don't have the equipment that's necessary to readily access. So it won't be anything that's helping them actually write the grant, but really more, excuse me, related to technical assistance. Those applications are due June 30th. Are there any questions regarding the child care provider RFP before I switch to housing?
May I ask a question here, Cindy?
Sure.
You had a webinar, you said yesterday?
Yes, there was a webinar, I think, yesterday morning that kind of walked through the application process. I wasn't on it, but I know we have members of the team here who were. If you would like some more information, Councilwoman, we can certainly speak to that.
Well, my whole deal is making sure that people know what's happening. Therefore, they know to get on a webinar. There's some kind of information that's been distributed so that everybody who could potentially access these funds will be aware of that. And so I guess my question is, how were they made aware of this?
Okay, Deb, would you like to speak to that? Deb Patterson, who's on the line.
Sure. They were made aware when they went on, anyone that went on the site looking at the application or the RFP was made aware of the webinars. We had one last week too, and all of those webinars are being recorded and they will be posted so that organizations can access that information later. We update the FAQs. We had a very, I would say, robust outreach to child care centers. The group that sent us the demand letter was made aware of the RFP, that it had been released. All of the St. Louis County Children's Fund grantees were also, or prospective grantees, people they have worked with in the past were made aware. I reached out to the rapid response team and made them aware, the St. Louis Community Foundation, and made them aware because they're also working with organizations. I reached out to the Deaconess Foundation that, has a whole initiative around African-American headed organizations and made them aware. So, and then I believe Andrea Jackson reached out to the organization she had worked with in the past. Hazel Mallory is our advisor on childcare. I sent it to her and she reached out to organizations in childcare organizations in North County. So that's what we've done in terms of outreach. If we have another one, we would be happy to make council members aware so they can also do appropriate outreach.
Is there any way you can determine how many were on the webinar? Do we have that technology, or?
I don't know that off the top of my head, Rita, but we can get that information to you.
Okay. Okay. All right.
Yeah, actually, we'll have a list for you, Councilwoman, and we'll share it with all members of the Oversight Council so they can know. I mean, we've tried to utilize formal channels, informal channels, kind of every avenue that we can think of, and certainly we're open for more suggestions. If there's constituents in your district that you think may or may not be aware of this or need more information, we would appreciate hearing about that too.
Okay, fine. Thank you. Let me ask you, is there a role for the Children's Services Fund in this? I'm not sure what, and I know that there is a dedicated funding stream that they have directly for children's services. So are they involved in this at all?
They are very much involved in this. They're a big part of the effort here. They're included in every meeting that we have, so they're very engaged with it. The challenge with we can't necessarily, the Children's Service funds are so restricted, we can't use those funds for what we're trying to do here, but they are very much engaged. In fact, they will be the ones who will help administer this grant effort.
In fact, Councilwoman Days, the Children's Services Funds resources, available dollars are committed through 2021. So there is no money to put towards this. And
immediate money. Okay. All right.
Immediate money to put towards this.
Thank you. Mm-hmm.
Great. Chris, would you advance the slide, please? So there's additional support for child care providers. One is through social and emotional wellness for children. We've allocated $500,000 for that as well. You'll also see under the Humanitarian Program, we have senior and homebound programs. Again, allocating $1 million to help serve seniors who are homebound by providing meals, care coordination, cleaning supplies, and any kind of PPE. And then technology. We continue to hear a lot, and I'm sure you all do in your districts as well. We do have a digital divide here within the county. And so trying to make sure that we can allocate funds to provide hotspots. I know, for example, just with the county libraries, they have quite a wait list just to access a hotspot, to sign up for one. And so allocating funds for that as well. And the important thing with that also is making sure that we work with the available other federal programs that provide technology, and through our knowledge there and what we're allocating here, hopefully we can try and bridge that divide even more. Are there any questions on the humanitarian before I move on to the second part of the humanitarian, addressing housing? Okay, Chris, would you advance the slide, please? So before we get into a conversation about housing, and my apologies if I'm stating the obvious to the council members, because you may know this so well, but I thought it was helpful maybe to kind of level set everyone in terms of housing affordability in St. Louis County. There's approximately 400,000 households in St. Louis County, and of those, 30% of households are cost burden, meaning they pay more than 30% of their income on rent. Now, about 80,000 of the 115,000, these households make less than $35,000 per year, and almost half or more are all renters. And so there is a real need within the county for housing, and we're seeing this, and we're hearing a lot about it throughout the community, and working with the rapid response team and Patrick over at Washington University. So there's a two-pronged approach to housing, really. We've got a homeless prevention. And through this, you can see housing advocacy, and this is $2.3 million that we've got rental assistance paying directly to landlords to help with those who are behind on their rent, security deposits, moving expenses, and other housing-related supports. And we've also allocated money for legal advocacy. This is to help those who are being evicted, maybe unjustly, that can help them get mediation, representation, and access to any other kind of public assistance benefits, and also counsel with issues related to family and domestic violence law. And so those are the where we're focused on. Chris, if you'll advance to the next slide. So if you, the housing and utility assistance, so rental and mortgage assistance with $2.5 million going to families, those directly affected by COVID, utility assistance, $1.7 million to help restore utility services or to prevent disconnections. And then again, another legal advocacy around civil legal support for those at risk of eviction or foreclosure. Chris, if you want to advance, please. So there's also other funding that's available for housing and homelessness assistance. There's HUD funding under the CARES Act, and there's also ESG and CBDG allocations that total $5 million. So you've got ESG 1.7 for homeless prevention and CBDG 3.3 for rental and mortgage assistance. And all of this really complements what we're trying to do around the humanitarian program. So if you look at the total investment you'll see in this chart, the housing stabilization, screening and referral, housing prevention, cares, the advocacy, the legal advocacy, homeless prevention, ESG. You can see how this is divided between cares versus ESG versus CDBG. The total investment that will be made in housing stabilization is $12 million. So we thought it was important. You can go ahead and advance the screen, Chris. Thank you. We thought it was important to share with
there are a number of council members on the call. I just want to check in and see if anyone has any questions. Okay, hearing none. Sorry for interrupting you, Cindy.
No interruption at all. We thought it was important to share with the council how we're making decisions here. This is not something that's going to be just very arbitrary. It's really, we're making decisions on housing based on data. And what we're using is the Health and Economic Risk Index, the HARRY 10. And Chris, if you'll advance the slides, please. Many of you are probably familiar with this index, but it's through Molly Metzer at Washington University, and it really looks at 10 COVID-related variables to produce an index score 0 to 100 for each zip code. And what we've then done is divide these zip codes into 3 groups by index scores. Group A is the highest risk, with it being over 50. Group B, moderate, 25 to 49, and Group C, lower risk, that's less than 25. Now we're going to spread the funds throughout the county, as you might expect, but really targeting those to the highest needs, and that's Group A and B. So Chris, if you'll advance the slide, please. So these are the health risk variables. You can see here asthma rate, COPD, uncontrolled diabetes, premature death rate, and then the economic risk variables, the individual poverty rate, the poverty rate for families with children, unemployment, the percentage of labor force employed at risk sectors, and percentage of white owner-occupied housing units. And I'm please stop me at any time if anybody has any questions. So this is stating the obvious, but economic risk and health risk are extremely correlated here. And then you can see each dot represents the St. Louis County zip code. It's used throughout here. So Chris, if you'll advance the slides.
Well, how do you know where oh, this is a zip code that correlates with this?
And then if you look at the next slide, Councilwoman.
Okay.
I think the next, Chris, if you'll advance the slide, please. So I think this map is very telling, and we certainly wanted the council members to know where the funds are going to be targeted. So if you'll look here at the color code, you will see where Group A is. And Group A, remember, this is where we have the most at-risk individuals, and 60% of our funding will be going in those zip codes. And if you look at Group B, that's the group that's, at risk as well, but not as much, obviously, as Group A. And you can see here by the map, 30% of our funding will be dedicated to those areas. And then Group C, this is the one where, it's not that there's not risks, but much less so than the other two. So 10% of the funding will be directed to those zip codes. So I'll pause there and see if any of the council members have any questions. We also have the author of this index, Molly Metzer, who's on as well, who can answer any detailed questions that the council members might have. But we felt it was important to really make sure we had visibility, or you all had visibility around how the investment will be handled. So it's those economically deprived, as well as there is an income component to that, because as many of you know, HUD funds, it's very income driven, and so that will also weigh in as well. So I'll pause for any questions, and sorry for rushing through this so quickly.
Well, I have a question.
Mm-hmm.
Ms. Brinkley, when you say 60% of funding, just exactly what does that mean?
Well, 60% of the $12 million that we've allocated for the housing stabilization will be directed to these zip codes that are in Group A.
And the total funding for this program in terms of percentages you've talked about is what?
Well, it's 12 million total for the housing stabilization.
Okay. So when the 60% only applies to the housing stabilization, not your entire humanitarian effort?
Well, I think what's important, and what we've said all along, and this is, if you'll recall at the very beginning of our efforts here, Spring Schmidt had also indicated that her funding's going to these underserved areas as well. She's in the process of doing a study that I think will dovetail with this as well. And this has been, I think, the entire, if you read the executive order, it was clear in terms of funds are going to be allocated to those areas that are in the most need. And so,
so let's cut to $12 million. Are we talking about $173.5 million?
We are using, this particular map is directed toward housing. If you look at the overall funding, we have said all along that the funding will be directed to those areas that are most in need. Will that be exactly 60%? I don't know if we could say that at this point, but I think you could say it would at least be that, if not more. So that's how we're directing it based on data.
So again, the 60% or thereabouts applies to the entire $173.5 million?
No, it does not apply to the entire $173 million. What this 60% is applying to, Councilman, is our housing allocation.
I get that, but you just...
So what we're also, if you recall, in our small business relief grants, we've allocated the same amount across all of the districts. So that's a separate bucket.
I understand that, but you've told me not 2 minutes ago, when referring to Spring Schmidt, that you expected her monies to at least resemble the disbursement in your map here. So my question is, as a person responsible for CARES Act money across the board, is this what your model is going to look like in essence with respect to the total amount of funding available to the county from the CARES Act, $173.5 million? I understood your answer to say just that.
So, Councilman, let me be clear. Number one, I'm not responsible for the allocation of the money. I'm an advisor that works on how the process is put together, okay? So let me clarify that. Secondly, this map that you're looking at is what we're using to apply to housing, okay? What the directive has been from the very beginning, from the county executive and the executive order, is that money would be directed to those areas that were most impacted by COVID-19. What Spring Schmidt is doing is a study that's looking at the impact of COVID and where it's hitting to make sure her dollars are allocated accordingly. So I can't tell you right now that this is exactly the formula. I can tell you this is the formula for our housing allocation. This is the formula how it will be allocated. There are other programs that we have, and I mentioned one. This is a small business relief program that was allocated equally across all council districts. So, but overall, what the funding is designed to do, and what the directive was, is to direct the funding to those areas most impacted by COVID. And that's the overall directive. If you're asking me for a exact specific percentage related to the 173, there's varying programs within the 173. So we can't speak with specificity with exactly what that will look like, and can tell you that this is how the money will be allocated for the housing. But what you can know is that the money will be allocated to those with the greatest needs.
If you're not responsible for allocation, who do you understand is?
Well, Councilman, there are many, many people engaged with this. There are, we have external advisors, we have members of the community, we have county staff, we have a myriad of people who are engaged in putting forth recommendations. The Oversite Council has oversight with regard to the funding. Well, so I'm not the one. I just want to make sure that I'm clear, Councilman, so you understand. I'm not necessarily the person who says this person gets funding, this person does not get funding. It is a very collaborative process that is made up of, and this is a very data-driven process as well.
Is that what you refer to, or other people have referred to as the CARES team?
I can't speak to that. I don't know who's called the CARES team or whatever. We're calling the overall effort the county CARES effort. So I guess you could extrapolate from that, but it is the county CARES effort in distributing.
And just to be clear, I do refer to you all as the county CARES team in my communications with the rest of the county council.
So, Ms. Brinkley, back to my question. If you're not responsible for allocation, can you identify to us who is?
Councilman, I believe this question has been asked and answered. It's a collaborative process.
No, I don't think it has been answered at all.
I think it depends on the program that we're talking about. There is a collaborative process between the county executive, volunteers, members of the community, and other leaders that are all participating in supplying data and opinions and concerns about where the greatest need is. It's not Cindy and Sam sitting in a room and making a bunch of decisions. This is a collaborative process. If you want to talk specifically or ask questions specifically about how this particular piece has been decided, then you can ask that question. Otherwise, we are going to move on. And I would like to remind everyone that I chair this meeting, and please do not speak until I give you the floor.
Ms. Brinkley, if you're not responsible for allocation, can you identify 6 key people who are?
Well, Councilman Tracus, I can identify you're one of the individuals who actually determines funding, and I can tell you through the Small Business Relief Program, each of the dollars that were allocated to each council district, the council members are responsible for determining who receives funding. So that's our small business relief funding. So
I'm sorry, Cindy. I'm also going to jump in here and say, okay, a few weeks ago, this committee was given an organization chart that shows who the key decision makers are and in what areas those are taking place. And we can recirculate that to you, Councilman, if that would be helpful.
I'd just like to hear the rest of her answer.
Go on, Cindy.
Okay, thank you, Chairwoman. So the Small Business Relief Program, those decisions are actually made by the council members.
That money's already allocated, $17.5 million, right? That's been allocated to that program.
That money is allocated, but in terms of who the recipient is not allocated.
That wasn't my question. My question was who decided the allocation? Let's pick that program, $17.5 million. Who made that decision?
That was a collaborative decision that was made with input from various members of the county executives team, through our volunteer advisors, through the data that we were looking at. It was not one individual that just determined how much. There have been several directives that have been set from the very beginning. And if I could elaborate on those. 3 directives. One is public health, the other is humanitarian, and the other is economic rescue. So those were the 3 buckets that were identified in terms of how we would make strategic investments. Other things that were determined was not knowing the full extent of the pandemic and where it was going. It was felt it was very important that we not allocate all of the money initially, that we allocate and get out to the community as quickly as we can those funds. That's why we started with basic needs around, which were food related, and got those funds out. We started the Small Business Relief Program because there were a lot of businesses who were having numerous challenges, and knowing that it would take a couple of months to get the money actually in the hands of the recipients. That program was started. Now we're working on more of the humanitarian around childcare and also housing. So we're looking at this in a collaborative way with, and as Chairwoman Dunaway said, if you look at the organizational structure, that is the leadership team that we've put in place. And again, input from numerous members throughout the community, from the rapid response team to various others who are providing input into this effort to make sure that we get the funding out to those who need it.
Thank you.
You're welcome.
Are there any other questions?
Madam Chairwoman?
Councilman Harder.
Yes. Can we go back a couple of slides to the daycare tricks?
You have a page.
It's where it showed how much each daycare center would get based on their population. There it is. My question here is, have we determined, I know in past meetings, we talked about daycare centers being treated as a business, that they would get maybe money under the business relief fund. And now we have this matrix to deal with, based on size of the daycare center. So have we determined what the rules are going to be? Do they get one, not the other? Do they get the better of the two? They get both? What are the new rules?
Well, Councilman, I believe, and it's been up to each council member to determine how they want to handle this, but it's pretty much, I think, been certainly discussed in the Oversite Council meeting that it would be one or the other, and that it would not really fall under the Small Business Relief Fund, but more in the child care provider.
So do you anticipate that the child care provider will go under this program, under this RFP, instead of the other
Yes.
business response?
Yes.
Okay. And also, have you looked into the new regulations that were put out by this administration that deal with all the how to handle the daycare situation under COVID? And is there any movement to relax some of those so that these daycare centers can accept more children and be able to serve the community better? than, you know, more along the lines of normal before March, up to the March levels?
Councilman, I have not been involved in those discussions, and I'm not familiar with that. I'm sure I can find someone who is able to address your question, but I'm not able to address that.
Because my understanding is if a child care center, say, handled, you know, 20 kids, that they have to be, you know, less than 10 or less than 6 or 7 going forward. And so that doesn't serve, in my opinion, doesn't serve the community. If they were already serving the community at 20 kids, now they have to come back to 6 or 7 or maybe 8 because of the COVID restrictions and the distancing and the hand washing and keeping two-year-olds from touching each other, that kind of thing. I think that would be very, very difficult to implement.
Well, again, I can't speak to that, but I can certainly relay your concerns on to those within the county who are making those recommendations.
Could we agree that if the child care centers were either exempt from those rules or given some kind of waiver, that they could better serve their communities and provide more child care just by relaxing the rules when it comes to taking care of these kids?
As a parent of of small children, I wouldn't want those rules relaxed. I want my children in a safe place, and I think it's really important that we support our child care centers so that they can either hire additional people or to pay for these additional services to keep them safe.
I agree.
And my recommendation would be to defer to the healthcare professionals in making these decisions instead of having this conversation here where we really don't know what we're talking about outside of anecdotal experience.
I'm just looking from the standpoint of sheer numbers. If now if we have to, if a daycare center handled 20 kids and now they have to handle 10, that means we're going to need at least one more new entry into the child care arena to serve just the same amount of kids we did back in January. And are we going to be able to get double the amount of child care providers just to keep the current demand satisfied? That's my point.
Chairwoman, I believe Spring Schmidt may be on if she wants to, you know, address any of those comments.
Yes, Spring, are you available?
Yeah, of course. So childcare facilities do not have capacity restrictions. We have talked about social distancing guidelines and ways in which we can support them, but they've been an essential business from the beginning. And we've tried to provide a lot of that support for how we can help them kind of minimize risks within their facilities. We know that some have voluntarily reduced some of their capacity, but our orders do not require them to reduce their capacity. We have asked them to work on providing some additional clarity for how we they can help keep the children as safe as possible, especially if they have larger groups of children. So we do not have capacity restrictions for childcare facilities at this time, but we do have significant expectations for their ability to maintain cleanliness, provide additional supports for the children. And so for the fund to contribute to them being able to do that, to protect the children.
Thank you.
Of course, sir.
Are there any other questions before we move on? All right, great. Looks like we're at the Small Business Relief Program.
Okay. So you can see here on the presentation, I want to walk you through what this actually means. And you see on your left, you see the district numbers, okay? And then you'll see the number of applications that were received. Now, originally we had, you know, over 3,000 applications, and this is really based on who has actually sent in the documentation, where we are. This is where we ended up. And if you look on the amount requested, you'll see that the total amount now is 21 million. However, if you look at the adjusted request, and that is at 10 million. And let me speak to that in just a minute. And then on the far right, you'll see a column that's entitled zeros. And what these are the number of applications in each district that may have had amounts put in each category, but when they totaled it up, they actually put in 0. So these 35 applicants will require outreach from our team, which we're in the process of doing, to make sure that they get their total, correct here. Now, the adjusted request, why is this so different than the others? Is because you will recall that our in the grant application, it said that these grants could be anywhere from, whatever to 15,000, and 15,000 was the limit. Not everybody stuck to that. We had actually 5 requests for over $1 million. We had numerous requests for well over 100,000. Actually, we even had one request that was almost a $3 million request. So those have obviously been, we have then taken those and made it 15,000 instead of what the original request was. So that's why you now see that the adjusted request is at $10 million. Any questions on this? And again, as you all know, the application, it all closes tomorrow. We extended it. We did robocalls. We sent an additional email. We've received approximately 300 calls within our small little call center here, and over 150 emails. And so I think the busiest day, from what I'm hearing, was actually yesterday in terms of people replying. So the team is still replying to questions and getting information out to as many. And some of these are requiring personal outreach, which we're doing. So I'll pause there for any questions that the council members may have.
Can you hear me?
Councilwoman Gray has a question. Go on.
So I know we had the compliance section. Again, like you said, it's going to expire tomorrow.
Mm-hmm.
Those figures be adjusted based on the compliance section as well?
Yes, Councilwoman, we will make sure that the members see the actual, the final version, if you will, in terms of, because this is still in motion. So with the deadline being tomorrow, I fully expect these numbers to change by tomorrow, but we will keep the council apprised of what the final look is.
And then I had a question earlier about the daycares.
Mm-hmm.
How do they know that they cannot get the SBR money because of that other fund? Were they notified? Were they notified?
Well, they may have applied, but that can be up to each council member to then direct them toward the child care. Just so everyone's clear, that is an entitlement program. So that is going to all of the child care providers. The SBR was something that they might have applied for. So, we can certainly distinguish between those child care providers from SBR versus the other entitlement program.
Okay, I just needed to get a clear understanding, but I can talk to you later.
Okay.
I have a question,
Councilwoman Days.
Thank you. We had in your initial presentation indicated that there were 982 applications submitted. And I think in your revised presentation, you now have 900 applications. What happened to the 82?
Well, upon further look at those, Councilwoman, we determined they were either out of district, they were just, they weren't valid applications, I would say, for lack of a better word. It couldn't validate their address. We were unable to validate them. And we were just doing a quick count in terms of determining how many had come in before we actually went back through and looked to see, okay, which of these are actually valid.
And again, the zeros, I'm not clear as to what that meant, the zeros.
Yeah.
So,
yes, Councilwoman, what that means is when these applications were sent in, what they were required to do was to list their business expenses and then with the total in terms of what they were seeking reimbursement for. And so what happened was they might list the expenses, but in the total, they put 0. So it was just a mistake. And so what we're planning to do, what we are doing is reaching back out to these applicants to walk them through to say, you needed to add up what all of these numbers are to get your total. And so that's what we meant by zeros. It's kind of an odd category there, but we had 35 of them. So we believe it was just an oversight on the applicants.
Okay. And as we go back through, and I guess this daycare, let's reiterate that in case they're listening, that it will be up to the council members to determine, I guess, if you want to apply for the small business loan, but you may or may not be getting that small business. But as a daycare, you will be, because it's an entitlement, you will be getting something from this CARES Act fund from your daycare center. Now, if we as a council person want to, you want to apply for that, we can also award you that if you fall within the parameters and all the qualifications. So you essentially can be awarded a small business as well as your entitlement program. Is that correct?
That is correct. That's up to each council member. We're obviously recommending that it just be one or the other, but that's, each council district is different. So, and your district's best. So I defer to the council members' decision on that.
I just wanted to make sure that I had the conversation correct. And yes. So I think that is what you have said to us earlier. So thank you.
Mm-hmm. Thank you.
Madam Chair.
Councilman Harder.
Thank you. Cindy, when do you anticipate the council members getting the information about these business applications so that we can start signing off and processing these checks?
Yes, those should be coming to you in the next week or so. I would say next 10 days, depending on how quickly the accounting firm can validate all of this. But the plan is we'd like to get them to you in batches versus all at once. We're still working through the logistics of that with the accounting firm, but that's our expectation, Councilman.
Okay, thank you.
Madam Chair.
Councilwoman Days.
Thank you. I am looking at another slide that would probably speak to that. We're going to get to that where the timeline is.
Yes, we can. If everyone is ready for the next slide.
I have a question, Madam Chair.
Councilman Tracus.
Just 1 second, please.
Thank you. Can you go back to the previous slide, please?
My statement.
Yes, Councilwoman Days.
Yes, I wasn't done yet. So as we look at this, we're looking at, I'm saying the 15th of June, that is where we will get batch, but not the entire application process there. In other words, we won't get everything by the 15th. Is that what you're saying?
Correct. That is likely correct, Councilwoman, right. Unless the accounting firm is just incredibly efficient and works through it quickly. I want to set expectations, and I don't expect you all to have everything by the 15th.
Okay. All right. Thank you very much. Thank you, Madam Chair.
You're welcome, Councilwoman Days. Councilman Tracus.
Thank you, Madam Chair. Ms. Brinkley, with respect to the amount of applications received by the districts, do you anticipate those numbers increasing from today forward in any way, shape, or form?
Well, I actually do. We'll see what the final numbers are, Councilman, but I do expect that they would increase. You know, I would expect that they would. I don't know to what degree, obviously, but I would expect that they would.
And I would expect that would vary from district to district, but you do anticipate that there'll be additional applications reviewed, approved, and then sent to the council members?
I do.
Okay. And then with respect to the amount allocated per district, as you mentioned earlier, it's equal. I think it's approximately 1.7 million. Is that right?
Actually, no, it's I think it's 2.5.
2.4.
Mm-hmm.
2.5.
2.5,
Okay.
I believe.
It's 2.5 million per district.
Yeah.
So let's just take my district, for instance. Right now, you're showing, I'm going to take your adjusted number, just under $800,000, right? So I would have the better part of $1.6 million left over. Can I increase the amount of awards? Do I have discretion to use that money at all under the program, or does it simply just revert to your, for lack of a better way to put it, central committee?
So again, these applicants have outlined their expenses according to what they are, which is with any kind of federal grant, Councilman, as you know, there has to be there has to be documentation that substantiates the amount of the grant. So I would recommend that it be based on what the applicant is actually asking for. If all of your money is not spoken for, then the plan is that yes, it would go back into kind of the overall CARES Act fund. There's other business programs that could be utilized as we get into it. The Economic Rescue Team is getting up and going, which is being chaired by Rick Stevens. They likely will have suggestions, and I'm sure working with council members and businesses across the county to determine what other programs might be helpful for our small business. But the plan is that if the monies are not fully allocated to the district, then the monies go back into the overall CARES funding bucket, so to speak.
And so just to make sure I understand clearly what you said, you had mentioned that it depends on what the business actually needs or applied for, but that would be capped at $15,000 regardless of what the ask was, right?
Correct. That is correct.
So for example, you've mentioned a few applications exceeded hundreds of thousands of dollars, 3 million. Obviously, we couldn't even entertain that beyond 15,000, right?
That is correct. Yes.
Okay. And then lastly, sort of weaving back towards the first question, the chairwoman and I have had an interesting conversation the last few days about the extension of the deadlines. And I'm just curious, it's my understanding that the deadlines for applications for the accounting firm to review and get back to us were part of a executive order. So I'm just curious as to your take on whether or not these deadlines are fluid. I'm not objecting to them. I'm just trying to make sure that I understand whether or not deadlines are deadlines per the executive order, or it's something that your team has discretion over in terms of extending any given deadline as we go forward.
Well, I don't believe these deadlines were set per executive order, Councilman. They have been at the discretion of the committee or of the team based on input. I know you, in fact, had input regarding some of the deadlines. There had been discussion at our preparation meeting for these working council meetings that in light of the extenuating circumstances externally and all of the things that were going on, we thought it would be best if we gave the applicants more time to get the information in. So we try to be responsive to what's our external activities that are going on and any impact that we have. So there is discretion there. We try to be fair to the applicants and make sure that everybody gets the same information, obviously.
Yeah, and like I said, I have no objection to it. I was just curious as to whether or not the executive order conveyed that discretion or not. That was really the nature of my question.
I'm not aware, Councilman. I can certainly look at that and respond to your question better, but I'm not aware of that being in the executive order, but I can certainly check on that and get back to you.
All right, thank you. That's all I have.
Madam Chairwoman?
Councilman Harder.
Just one question. I just want to be very clear on the adjusted request. Right now, it's looking like a little over $10 million. We budgeted 17.5. The difference, the $7 million difference, is going to go to a different business related bailout or help, or does that go back into the overall fund to be spent somewhere else or on something else not related to business?
Yeah, well, we had, if you may or may not, Councilman, have seen the overall budget in terms of how the $173 million had been allocated. So that would stay within the business allocation, if you will, within the economic bucket. So it could be used for another program.
So to be used for another program, we'd have to come up with a different program because there was only one business related program that I remember.
Well, this has been the only business related program that's been developed so far, but as we've talked about, we have intentionally not wanted to spend all of the money up front. We did think that we would spend all of the 17.5 million, but on this particular program, but it can be reallocated to other business programs that may be developed in the very near future.
And the last question, is this money separate from the money that the St. Louis Economic Partnership has been giving out in the forms of grants and other things? Is that a whole different pie of money?
Yes, it is a different pot of money, if you will, Councilman. My understanding is that their money is actually $5,000 loans that are going to businesses across the county. And this is a completely separate, and this is coming directly from the federal government, and it's under the CARES Act funding.
Do you know how much they got in their bucket for those loans?
I am not aware of how much I know the amount of the loans that they are distributing, but I don't know the overall amount that they've allocated.
Okay, thank you.
Okay, Madam Chairwoman, if it's okay, I'll go ahead and kind of walk through the timeline here a little bit.
That would be great, thank you.
Just a reminder that additional information was sent out June 1st. We set up a hotline and an email account that are taking questions from constituents and replying back to them. We extended the deadline to June 10th. We let everyone know through robocalls and emails, and thanks to many of the council staff for the great suggestions there. We really appreciated it. Hopefully around June 15th, to start getting the first batches of those certified businesses. And then we'll start allocating funds in July, then, early to mid-July. Any other questions on the Small Business Relief Program? Okay, if not, Madam Chairwoman, I'll move on to there was a question at the last Oversight Committee hearing around the actual police expenditures. It was actually kind of lumped in, if you will, for lack of a better word, with the overall EOC budget. And so what we've done here is to kind of outline in terms of what those expenses are. We've got it here just in terms of subjects. If you'll go to the next slide, Chris, please, you will see it actually by vendor. Sorry, they're on two separate, different, maybe a little difficult to see, but this is a little bit more detail on the police expenditures, Madam Chairwoman, that that had been raised in the last working session or oversight session.
Can you tell me, Cindy, what percentage of our CARES funding is going to the police versus the EOC?
I think it's an extremely small percentage. I have like less than 1%, Chairwoman. We'll get you the exact amount, but I believe it's overall like less than 1%. It's a very small percentage.
May I ask a question? I'm trying to make sure I understand this. Madam Chair, may I ask a question, please?
Yes, Councilwoman Days.
Okay, are we looking at personnel here in terms of some of these expenditures? I'm looking at PPE, I'm looking at business and maintenance. So none of this is actually personnel. We're not paying any overtime or anything like that with this police expenditures.
That is correct.
I don't see that here. I mean, it could be under other expenses, but I just need to make sure.
No, Councilwoman, that's my understanding as well. This is not this does not show overtime through here.
Overtime, additional officers, anything like that?
No.
Well, that would make. I guess that would be that would be clear. You're excluding payroll and fringe. When you put that up there, it made me think that you were perhaps adding personnel, because you wouldn't add fringe benefits to clothing and protective equipment. I don't think.
Correct.
Okay.
One would hope, yes.
Okay.
Madam Chairwoman.
Are there any? Yes, Councilman Harder.
I have a question. There was an article in the paper the other day about the hotels that we contracted with. I believe there were 4 of them to be used for first responders and anyone else that needed to quarantine separate from their home address. Do you know the status of it? Because in the article, I believe it said there was only like 8 or 10 people that are housed in these hotels, and I believe we contracted with 4 different fairly large hotels. Are we still under contract? Are we still spending money on empty housing, or how does that work?
I don't know the answer to that, Councilman, but I wonder, Spring, Schmidt, are you still on? Is this something you could reply to?
Of course. So we never contracted with all 4 of the hotels. We did put out an invitation for bid, and we did get 4 additional hotels that gave us bids that we had optional contracts, but we aren't spending any funding on those. We do spend funding on the Hawthorne Suites. It is available for those that are unhoused, some members of the general public who cannot safely isolate or quarantine away from their families, as well as first responders. And so that has in and out, and we are talking about how to reduce that overall capacity. We have had opportunities. So we originally participated in that program and moved that forward in collaboration with the state. So we do have opportunities to provide additional reimbursements for either the state from some grant funding that they got, or through FEMA as well for some of the costs that we have incurred for that hotel. So we did have other options in case it was something that needed to get bigger, but we do not have any financial obligations to those other hotels.
How many people are we housing currently?
I think it is 10 at the moment, but it fluctuates fairly regularly, and it takes some time because of the length of time they are required to be there.
How many what was the maximum we've housed during this crisis?
That I don't have at the top of my head. So we have not utilized the full hotel, but we have utilized it for a variety of people over time. And it has
the million. So on your graph here, the $1,026,000, is that spent so far for those 10 people or for other expenses related to the hotel contract?
It is, yeah, I think it is the full that is the specific to the hotel for the full services of the contract. Yes.
So do we pay for the rooms even though we're not using them?
That is correct currently.
So we've basically bought the hotel for this period of time.
That's correct, for it to be available. And these are all COVID positive people who have nowhere else to safely isolate or quarantine.
Okay, but that's one hotel. The other three we did not contract with. Is that?
Have options to contract with them if we had ever needed that capacity, but we have no financial commitments to them.
Okay, thank you.
Certainly.
Councilman Tracus, I believe you have questions.
Thank you, Madam Chair. Ms. Brinkley, $1,026,000 identified as a Hawthorne Suites expense. Ms. Schmidt has just told us that currently they're housing about 10 people, but that expense represents effectively the reservation of the entire hotel. Is that right? Is that accurate?
Councilman, I would have to have Spring Schmidt speak to that, please.
That's fine. That's fine.
Correct. And it's over the last 3 months. So it's not for the 10 people that we have there now. It's been for all of the people we've housed over time.
All right. And then am I correct in understanding your previous response, Ms. Schmidt, that the people that have been housed there are not all police or law enforcement? Is that accurate?
That's correct. We separated other sections of the hotel because it's separate buildings. So they're not housed like together. They're able to be quarantined within the facility as well.
Right. So you have, for instance, probably frontline healthcare providers that have to be housed in there?
That has been an option, as well as the unhoused and
right.
who are homeless.
Okay, so help me understand then how the entire $1,026,000 is attributable to the police.
It's not. It's just the EOC, sir. So these expenses are as part of the emergency. So this has been a public health emergency. And as we began this, when we were working at the EOC, it was joint command between the Emergency Operations Center, the Public Health Department, fire and EMS, and the police were involved as well. But it was predominant. These were the decisions that were made for the public health emergency.
And so that would be applicable to the entire amount shown on the slide right now, not just the $1,026,000 for hotels, but every dime that's shown up there, correct?
So I don't know the specific breakdown of the other category, but yes, this was funds expended by the Emergency Operations Center, which is technically part of the police department. But it was a public health emergency, and these were decisions that were made jointly for the nature of the emergency.
And distributed to police, but also to frontline responders, healthcare providers, and the unhomed or unhoused, as you refer to them?
That's correct. Fire, EMS, healthcare workers, long-term care facilities, like all of the decisions we made for the emergency.
Okay, thank you.
Yes, sir.
Would it be possible to get a breakdown of this to find out exactly what's been EOC versus what's gone directly to police?
Chairwoman, yes, we will do that. We can have it for the next meeting if that's helpful.
I think it would be really helpful. Thank you so much.
Madam Chair, if I could follow up one question, please.
Yes, Councilman Tracus.
Ms. Brinkley, and again, all of the monies that we've talked about, if I understood your testimony correctly, constitutes less than 1% of total CARES Act money?
Yes, for the police, yes.
Yes, thank you. And when you say police, you mean emergency operations and frontline fire and all of that? Just designated police because that just happens to be where you put the bucket?
It's The Emergency Operations Center is run by the police department. It is a section of the police. So everything that they have expended on behalf of the public health emergency is in this category.
Okay. And again, less than 1% of the total CARES Act money.
Yes, looks like.
Thank
yes.
you.
Great, thank you. And Councilwoman Gray.
Yes, two questions. The quality in the fluorescent, I guess what you're saying is you did not have to use that.
Ma'am, that was not organized by us. That was organized by
Right, that was the state. That was the state.
That was the state and the hospital systems. Yes, ma'am.
And then secondly, there are some areas where it is virtually impossible for a family member to quarantine. They may have a 2-bedroom house with 6, 7, 10 people in it. Was the hotel utilized for those type of people as well?
Yes, ma'am. We have told all contact tracers that the hotel is available to any member of the county residents who would like to use that facility. We have also housed members of the general public there who cannot safely quarantine at home.
Okay, that's what I wanted to clarify. Thank you.
Okay, is this the last slide?
Yes, Madam Chair, I was just going to say that concludes the presentation for today.
Are there any final questions for Cindy and her team?
Madam Chair, I have one other question, follow up.
Councilman Harder.
Spring on that hotel, one hotel, and how many rooms are in that hotel? Do you know?
I think it's 120.
120. And we reserved the whole complex, correct?
Yes, sir.
So they're standing vacant until we need them. Is that correct?
They are available for whoever needs them, that is directed there by either the first responder team at the EOC or the health department or the human services group for the unhoused. We are all using it.
Go ahead.
I think that we will need some additional capacity for those folks who cannot safely quarantining people from preventing the spread is absolutely critical to us all moving forward. We are trying to find some ways to kind of roll down some of this capacity, but it is critical that we have a safe place for people to quarantine.
But currently we have 10 people there doing that.
That's correct, sir.
Out of the whole St. Louis County region, or St. Louis County.
That's correct.
So that's the only location.
That is our only location.
Okay, thank you.
Spring, do you think maybe you can let us know how many people have stayed in the hotel since the pandemic broke out?
Yes.
Thank you.
I would like to add something.
Yes, Councilwoman Gray.
I've spoken with a couple of hospital administrators, or I won't say they were both, but a hospital administrator and a couple of other medical administrators, and some were not aware of the hotel availability, and I think more people would have taken advantage had the hospital known about it. He does know now, and he will send people, but it is a concern in certain disadvantaged areas that the people have to stay in the same house, and it's not really helping the rest of the family when that happens. But I mean, I don't think we have a choice. If people are COVID positive, I don't think they want to use only half of the hotel or 1 floor or 2 floors. I don't think that's safe. I mean, I could be wrong, but I think we're just doing what we have to do.
So this facility undergoes some pretty significant disinfectant procedures with us. This facility is geared entirely towards people who are COVID positive. This facility works as a partner to maintain the level of protection.
Right, that's what I'm saying.
Great, thank you. Does anybody else have any questions?
Madam Chair.
Yes, Councilman Tracus.
Thank you. I just wanted to thank Ms. Brinkley and Ms. Schmidt today for all their hard work. I know it's not easy, and I spent a lot of time at it, and so I just wanted to acknowledge that. And it's not easy coming in here and having to answer hard questions, but they do it, and I appreciate it. And I didn't want this meeting to end without at least giving them that shout out. So thank you.
Thank you, Councilman. We appreciate it.
And thank you, Councilman, for saying so. And we also really appreciate you showing up here every week and taking our tough questions. So before we do move on, I do want to check in with Councilwoman Days, because we have had for a couple of weeks an agenda item with your name next to it, and I wanted to see if you were prepared to talk about that today. A diversity strategic plan.
Yes, actually, I have been thinking about this for a number of weeks, and we were looking to the 45 or 47 that we thought would be utilized for our municipalities. And we have since discovered that that may not be the case. We have 89 municipalities in St. Louis County, and I think that we need to start looking at how these various municipalities are going to recover after this pandemic. I'm not sure if all of them are in a place where they need to be in terms of recovery. And so I'm going to suggest that we look at perhaps putting together some strategic plan on how we can make sure that they are made whole, or not necessarily made whole, but at least they are not devastated by this pandemic. So I am working with a couple of people, but I want to make sure that we have that as part of Cindy's, and I guess it would be part of the economic bucket that we have, looking at how we will structure a recovery for our municipalities. I put together a kind of a little a breakout here. I will send to the members of the committee, Cindy and you, and look at it and see what we can do to make sure that the municipalities are not devastated by this pandemic. So as we look at the survival, actually, it's the survival that these folks are going to be in. I'd like for you to read that and get back with me to see what you think about it, additions or subtractions, or what you think will actually work for this would be very helpful for me at this time.
Madam Chair, may I respond to Councilwoman Days?
Please do.
I appreciate your comments very much, Councilwoman. You know, this has certainly been on our radar as well. The CARES Act prohibits us right now from being able to use any funding for lost revenue. We are, however, really paying very close attention to what's happening at the federal level, because, you know, I know there's a lot of discussions around this, and there's a recognition that, you know, these cities, these municipalities are going to be really struggling. So I appreciate what you're doing, and we look forward to working together with you to see how we might be able to get together a plan that would be beneficial to these municipalities.
Thank you.
And thank you, Councilwoman Days, for making sure that we stay focused on diversity. Does anybody else have any questions or comments before we move on to the public comment? All right. I think we're ready for public comment.
Okay, Madam Chair, we had 2 comments submitted for this meeting. The first one was from Pat Kelly, the Executive Director of the Municipal League of Metro St. Louis, 11911 Dorset Road, Maryland Heights, Missouri, 63043. Dear Chairwoman Clancy and committee members, on behalf of the Municipal League of Metro St. Louis Executive Board and our 83 municipal members, I would like to go on record that municipal public safety expenses incurred between March 1st, 2020 and December 31st, 2020 are eligible for reimbursement under the CARES Act. The county has stated they have set aside $47 million for municipal public safety expenses. Given that the $47 million represents less than 1/3 of the actual municipal public safety expenditures over a 9-month period, we would like to suggest establishing a per capita distribution system to ensure that the available funds are distributed in an equitable fashion. The League is prepared to assist the county and your committee in evaluating and implementing the distribution process. Below is a list of 23 cities that have passed resolutions similar to the one attached, entitled a resolution requesting that municipalities within St. Louis County receive an equitable distribution of the $175 million in funding received by St. Louis County from the Coronavirus Aid, Relief, and Economic Security Act to reimburse municipalities for actual public safety costs incurred related to COVID-19. And those 23 cities are Bonita Park, Richmond Heights, Pagedale, Northwoods, Jennings, Hazelwood, Frontenac, Florissant, Ellisville, Chesterfield, Bridgeton, Brentwood, Berkeley, Woodson Terrace, Maryland Heights, Glendale, Fenton, Clayton, Crestwood, Kirkwood, Manchester, St. John, and University City. Our second comment was submitted by Tom Sullivan, 751 Syracuse Avenue, University City, Missouri. It is good to see the committee is finally complying with the law and has a meeting agenda. I was unable to watch or listen to last week's meeting, which is held at a bad time for most people. Since the video or minutes of the meeting are still not available, I don't know what took place. The continuing problem with the Oversight Committee is that it is providing no oversight and wasn't designed to. Along with the misnamed CARES Committee, it is part of the effort to bypass the County Council and avoid public scrutiny while promoting the election of Sam Page and the members. It should be remembered that Cindy Brinkley, lead advisor for the CARES Committee, has given the maximum contribution allowed to the Sam Page campaign. Executives at the company where she worked, the Centene Corporation, have given nearly $100,000 to the Page campaign and will likely give more. As I previously said, there has not been adequate explanation of the expenditures made by St. Louis County government on the effort to fight COVID-19. Sam Page said he isn't involved with purchases, and this committee takes weeks to explain how many masks are on a particular invoice. On March 19, the county received an invoice for face masks. The invoice total was $747,000, but didn't tell how many masks were being bought. Raising even more questions, the county has never done business with the company before. A March 15 memorandum from the county auditor to the committee provides little information on the mask purchases, but indicates there will be further information. I don't know of any further communications to the committee. There are still questions about the $2.6 million in food expenditures announced by the county executive on May 13th. It isn't known why these organizations were selected, how the grant amounts were determined, what food would be bought, or how the food would be distributed. The $100,000 food grant to the Link Markets is especially questionable. The organization was supposed to provide fresh produce to underserved neighborhoods, one at the Wellston Metrolink station and one at the North Hanley station. Both are now closed. The Oversight Committee continues to ignore citizen concerns or questions despite the stated purpose of the committee. Thank you for listening to my comments. That is all the public comments, Madam Chair.
Thank you so much. Would anyone like to make a motion to adjourn?
So move. Days.
Do I have a second?
Second.
I don't think you can give the second. I think I need it from Councilwoman Gray.
Where is she?
Councilwoman Gray, we're waiting for you.
Second, sorry. I can
Thank you. That's okay. We all do it. Thank you. Before I do adjourn, I want to remind everyone that there is a committee of the whole at 1 p.m. today where we will meet for the first time our new St. Louis County Police Chief, Mary Barton. So please tune in at 1 o'clock. And thank you all so much for everything today. I hope everyone has a great day, and this meeting is officially adjourned.